she doesn't look uncomfortable. I don't feel like she's in any pain, but she's obviously having vision issues like you guys are noticing. And all of her issues stem from an issue inside of the eye. So normally, the lens is this clear structure which sits right here in the center of the eye. And what typically happens is light enters in, it goes through this clear lens, and it gets to the back of the eye. And that's what allows for normal vision. In Goldie's case, her lens does not look like this, but it looks like this. So she has a pretty, what we call mature cataract. So it takes up the whole lens. So what that means for her vision is when light enters in, it hits this cataract and it just physically cannot get to the back of the eye. So that's
it's not focusing back there.
It's not even able to get back there. So it's like light hitting a wall. So we need a nice clear window for light to be able to get back here, to be focused back here. It's not even getting back there. So instead of going through the lens, it goes in, it hits this cataract, and it just doesn't even get back here, which is where we need it to get for a dog to see appropriately. Cataracts, aside from causing vision issues, they can cause other issues inside of the eye as well, which you probably read. Yeah, so the big things we worry about are they can create inflammation in the eye, which makes the eye like red, uncomfortable. She doesn't have any inflammation, which is good. Just like you alluded to, they can also cause glaucoma or high pressure. And the good news is she does not have glaucoma. Her pressure is normal, which is good.
Awesome.
The one thing that she does have, you alluded to it when we first started talking, is when a cataract develops in the center of the eye like this, think of that as it makes the lens very heavy, and the lens is normally held right in the center of the eye like this. With having a cataract, that lens gets heavy and things can kind of shift out of place. And in Goldie's case, her lens is starting to shift out of place. So it's something called a lens subluxation. So that just means the lens is moving out of place slightly. It's not completely luxated, not completely.
It's not floating around.
Yeah,
it's
just starting to. It's subluxated. It's
we're
just
out
starting.
of focus.
Yeah, exactly. So that is important, because if her lens completely falls out of place, it can fall either to the front of the eye or it can fall to the back of the eye. And when that occurs, if it falls to the back, that doesn't usually hurt. Falls to the front, that usually is uncomfortable, and they get really squinty. They can also develop glaucoma more readily because the lens falls out of place.
That's what happened with the other eye.
Exactly.
That's why I had
It
to
was
come
floating
out.
around
It was
in there.
literally floating.
And if
all over
that
the
occurs, we fix those all the time. We go in there, we just take the lens out, and they can retain vision from that. But I just want to guide you guys appropriately and do what's best for her. So when a dog has a pretty advanced cataract whose lens is starting to subluxate, move out of place, we have a couple options. So we can consider surgery to remove the cataract. The downside is when the lens is starting to move out of place, it prevents us from placing an artificial clear lens. Because normally what we do is we go in there, we make a little incision, we go remove their cataract, and we place a clear artificial lens in that location. That's the ideal goal of any cataract surgery. When the lens is moving out of place like this, we go remove their cataract, which gives them a nice clear window to the back of the eye, but we're unable to place an artificial lens, mainly because if you can see these little gray structures, those gray structures are what hold the lens in the center of the eye. And when the lens is subluxating or moving out of place, those gray structures are abnormal, and if we place an artificial lens there, they won't hold, and that artificial lens could fall out of place as well. So it's more harmful to try to place an artificial lens.
So it's better just to remove the cataracts.
Yeah, exactly. So what that would mean for her is, we go remove the cataract, that creates a nice clear window to the back of the eye, but by not placing an artificial lens, that means the eye is farsighted. So she won't be able to read a newspaper, but she'll be able to see arm's distance away and further. So it will improve her vision just by removing the lens, but it won't give her good near and far vision.
Yeah, she won't have clear vision, but she'll have vision.
Yeah, exactly. So I think we can improve her from where she's at now. Because you have to look at her right now. I don't think she's really seeing anything. And if we can remove her cataract or remove the lens, though we can't place an artificial lens, I think we can get an improvement and potentially get her back to functional vision, essentially. The thing that we do require 2 tests before we just jump forward to surgery. So the 2 tests are aimed at evaluating everything back here at the back of the eye, because we need everything to be normal back here,
Right.
meaning that if I take the cataract out, she'll be able to see. Because if things are not normal back here, it's not worth spending your money, putting her through a procedure if it's not going to benefit her. So the 2 tests we do are very easy, non-invasive tests that we do while they're awake. We just put a little numbing drop on their eye. We ultrasound the eye. So we stick just an ultrasound probe on the eye that goes through a cataract, and it lets us see everything back here to make sure that it physically looks normal.
Yeah.
Assuming everything looks normal, the second test we do is an electrical test. So sounds crazy, but we put a contact lens on the eye that puts flashes of light to the back of the eye, and that tells us how well things are functioning back here. So if things are functioning and look normal, that means she passes the test, and removing the cataract should improve her vision. Versus if things are not functioning normal back here, even removing the
I
cataract.
guess there's no reaction.
Right. If things are not functioning, because again, this is where all the structures responsible for vision are located. And if things are not functioning, again, it's not necessarily worth pursuing surgery. Let's say she does pass those tests, and you guys say you want to move forward with things, then we would move forward with surgery. Surgery does need to be done under anesthesia, just because we need her nice and still. We don't want her to feel anything. It's done under a big microscope. Like I mentioned, we go in there, we make an incision, remove their cataract, kind of clean up the inside of the eye a little bit, and then suture that incision closed. And then we'd call you when we were done just to give you an update, let you know how she was doing. We usually do like to keep them overnight one night to make sure that her eye is going in the right direction before sending her home with you. Then, Kenny, you already texted.
She's
them, aren't you?
wiggly.
Yeah.
Very.
Then what we have the easy part because we do surgery, and then we send them home with you for the recovery. And you obviously take excellent care of her, but the aftercare is the most important part. So what you're looking at is doing some eye drops, and the eye drops, it sounds like she's been on before, but are usually 3 to 4 times a day.